You know, when we think about healthcare, our minds usually jump to doctors, nurses, maybe some high-tech machines, right? But behind all of that, there's this hidden system, a world of documentation that can literally mean the difference between life and death. So today, we're going to pull back that curtain and look at the critical and often overlooked world of medical notes.
So let me just kick things off with a question for you. In a system that's just packed with complex surgeries and super powerful drugs, what do you think is one of the biggest, most underestimated threats to a patient's safety and even a hospital's survival? The answer? Well, it's probably not what you're thinking.
That's it, the empty page. Or, a page with sloppy, incomplete, or just plain missing information. It seems like simple paperwork, but a single gap in a patient's record can set off this domino effect with some truly devastating consequences.
Welcome to what I'm calling the documentation danger zone, because getting these notes wrong isn't just some small clerical error. It puts patients, staff, and the entire hospital system at risk. The stakes here are incredibly high, and we're about to break down exactly why.
Okay, so first and foremost, the biggest danger is to patient care. I mean, just imagine a doctor trying to make a life or death decision with only half the story. An incomplete health record, it's like trying to navigate a city with a map that's missing half the streets. It can lead you straight into medical errors. A doctor might prescribe a drug that a patient has a known allergy to, all because that one crucial detail was never written down.
And this quote from our source material really just lays it all out there. It's chillingly direct, and believe me, it is not an exaggeration. The quality of documentation can absolutely be a matter of life and death.
All right, danger number 2, communication breakdown. Think about it. A lot of us see multiple doctors, right? Specialists, primary care. The medical record is the one thing that connects them all. It's kind of like a shared brain for the entire care team. But when that record is flawed, that brain just, it can't function properly. The team can't talk to each other smoothly, and that can lead to conflicting treatment plans and a really dangerous breakdown in care.
Poor documentation also hits the hospital right where it hurts, the bottom line. See, if the notes are incomplete or they're not accurate, insurance companies can deny or delay payments. And this isn't just a paperwork headache. No, it can seriously destabilize the entire financial health of the hospital, which can then lead to very real cuts in services and staff that affect everyone.
And finally, you've got legal liability. In the world of medicine, malpractice lawsuits are, unfortunately, a constant threat. A clear, thorough, and accurate medical record is often the single most important line of defense. It's not just about protecting the hospital as an institution, it's about protecting the actual doctors and nurses who are out there trying to do their best for every single patient.
So, if bad notes are the problem, then what's the solution? Well, it's all about reframing the process. We have to stop thinking of documentation as just filling out a boring form. Instead, we need to see it as building a complete story, like a detective meticulously investigating a case. Let's take a look at how that story actually gets built.
This story, it has a clear structure, built from 6 essential parts. It kicks off with the chief complaint. That's the main reason the patient is even there. Then you dig into the history of present illness, which is the detailed play-by-play of their symptoms. Next up is their past medical history, any old illnesses or surgeries. Then you've got family as social history, which gives you all that vital context. And finally, the review of systems, which is like a head-to-toe check-in. Every single piece is a critical clue in solving the medical mystery.
Now this one, the HPI, or History of Present Illness, this is the absolute heart of the patient's story. It's not just a list of symptoms. It's a detailed, chronological blow-by-blow of what is happening to the patient right now, ideally in their own words. This is, without a doubt, the most important chapter of the record, because it's where the clinician finds those crucial clues they need to start cracking the case.
And to write that chapter well, clinicians basically become detectives. They ask these fundamental questions to really unpack the illness. Think of it like the who, what, where, when, and why of a medical investigation. When did it start? Where does it hurt? What makes it better or worse? Each answer adds another crucial layer of detail to the story and gets the doctor that much closer to the right diagnosis.
So, we've seen how critical these notes are for one single patient. But what happens when you take thousands of these individual stories and put them all together? Well, all that data becomes a kind of report card for the entire hospital, driving huge decisions on everything from staffing levels to what services to offer. And what's really amazing here is just how versatile this data is. So, for example, on one hand, you have something like an ED fast track report. It uses documentation to analyze patient flow in the emergency room to cut down on those awful wait times.
On the other hand, you have an overtime report, which uses data from employee time clocks to manage budgets and staffing. So you've got two totally different functions, one about patients, one about money, but both are powered by the exact same thing: accurate documentation.
But, and this is a big but, this push for efficiency has to be guided by what's best for the patient. I absolutely love this quote from Dr. Evan Fieldston because it's such a powerful reminder. While data helps a hospital run smarter, the goal isn't to be a hotel with strict checkout times. The goal is, and always has to be, providing the best possible care for each and every person who walks through those doors.
So we've established how important it is to get accurate and complete medical notes. But how do clinicians get that information in the first place? Well, it's not just about medical knowledge. It's about being a great communicator. There's a real art to asking the right questions in the right way.
Clinicians have two main tools in their toolbox for this: open and closed questions. An open-ended question, like, "Can you describe the pain for me?" invites the patient to tell a story. A closed-ended question like, "Is the pain sharp?" gets you a quick yes or no. A really skilled interviewer knows exactly when to use each one. They might start wide open to build rapport and get the patient talking, and then narrow in with those closed questions to nail down the specifics.
Okay, let's bring this all together. At the end of the day, why does this hidden system of notes really truly matter? Because it's the bridge. It's the thing that connects the deeply personal story of one single patient to the complex, data-driven engine that runs the entire hospital.
And that's really the bottom line here. Every single note, when it's done well, doesn't just help one patient in one moment. It feeds into this much larger system, creating a virtuous cycle that improves care and boosts efficiency for everyone. It means shorter wait times for you, fewer medical errors for your neighbor, and just better outcomes for all of us. It's how we build a safer, smarter healthcare system, one note at a time.
And that leaves us with one final big thought for the future. As technology, and especially AI, starts to play a bigger and bigger role in documentation, the real challenge is going to be, how do we preserve the nuance, the empathy, the humanity inside all that data? How do we make sure we never lose sight of the human story that's at the heart of it all?